Hello, welcome back to Medicine Chopped. My name is Mwasia Wanjiru, registered clinical officer. Thank you for this far. Today is the 5th episode and we are going to be talking about urinary tract infection in men, and also we are going to be baking some barbecue. That is sweet. Yeah, so let's get to it. Infection is infection that occurs along the urinary tract. The upper part, that is the kidneys and the ureters, and the lower part, that's the bladder, the bladder, and the urethra. So the infection is mostly brought on by the E. coli bacteria, which is a natural occurring bacteria in our body. Now, it's not much rare to get men with the urinary tract infection, but compared to women, the rate for men is lower, and that's because men have a longer urethra compared to the women. So the most common symptom that you get in urinary tract infection in the males is pain when urinating, and that pain is usually described as burning pain, which in the medical term is dysuria. At times you might notice that your urine is smelly, it's cloudy. You might even experience lower back pain, lower abdominal pain, and sometimes you'll have some pain on the sides. And if this infection spreads into your blood, then the bloodstream takes it to the whole of the body. This leads to infection in your blood, and thus you'll have fevers, headaches, nausea, and vomiting, which is a serious thing, which can even be as a very serious disease that you'll have to be admitted because of it. The other cause for urinary tract infection, and this usually happens in men who are over 40 and above, it's benign prostatic hyperplasia, and that's when your prostate has enlarged, and thus there is constriction along your urethra. The risk factors for urinary tract infection: 1, it includes not drinking enough fluids or water specifically, because water helps to clean off the bacteria that's along your urinary tract. Another thing is that if you are immobile, so you do not remember to take the water, you forget, you even forgo going to the toilet for you to take a pee, so the accumulated urine, then it becomes too accumulated with the bacteria growing and growing, and thus it can cause urinary tract infection. Another risk factor is having unsafe sex, and that's why in my first video I talked about condoms, and that's because STDs predispose you to having urinary tract infections. There'll be a slide attached that differentiates between STDs and UTI. For investigations, when you go to the hospital, the doctor will recommend that you get a urine analysis done, and the urine analysis usually shows the level of bacteria, if there's blood in your urine. And let's say if you keep having recurrent urinary tract infections, the doctor will recommend having a urine microscopy, and also you'll have a urine culture and sensitivity, and that usually helps to identify which drugs are not sensitive to the bacteria that's within you. Then you might also get to be recommended for an ultrasound, and that's in case where that the infection has spread to your kidneys. And most of the time, because as I said, it's rare for men to get urinary tract infection, you find that by the time they come to the hospital, it's already reached at the level where it's at the kidneys. Ochili, ngoja acha kwanza nitoe. The treatment for urinary tract infection is antibiotics, which are given if it's upper infection, you're given for 2 weeks, and if it's a lower tract infection, you're given for 7 weeks. And with this, you're supposed to remember that you should take your medication until the last day, even if you feel better. And that's because if you do not finish the medication, the bacteria will have the opportunity to grow back again, and you'll keep having recurrent infections. And as I said, if some certain antibiotics don't react well to the bacteria, you have a urine culture and sensitivity done, so that you can be able to know which medication specifically can be correct for you. And as I said, for prevention, just avoid the risk factors that I put on previously. Thank you for watching. This was great and wonderful experience for me, being the first time making a barbecue. It's really sweet actually. I'll show you how soft it will be. Please go on and subscribe, like, comment. I posted a question on the discussion tab. Please go on and answer it. Also, next time we are going to be talking about antenatal clinics, and we are going to be making calzones. Thank you. See you then.